watching NewsX. My name is Vineet Malhotra. Get back to you momentarily, but in the meantime, let's get answers from our other panelists. Joining me on the show is Reena Gupta of the Aam Aadmi Party. She's the spokesperson for the Aam Aadmi Party. Dr. D.K. Gupta is with the CMD of Felix Hospital, and Rajiv Chaudhary, political analyst, also joins us on the broadcast. Thank you, everyone, for being a part of this, very important discussion. In fact, this is a discussion which has taken place a number of times before as well. But the fact of the matter is, Dr. Gupta, that the Delhiites on a regular basis, on an everyday basis, are risking their lives now in dealing with two nuisances. One is obviously COVID-19, which hasn't gone, and the other is this pollution. What kind of a risk are we running by just stepping outside of our houses every day?
Are you able to hear me?
Yeah, loud and clear. Go ahead.
Yeah, we all know that this coronavirus affects our lungs. Basically, it affects our lung mucosa and it damages it. And on this mucosa, a coronavirus attacks, and there it is the place where it got replicated. It got that result in inflammation and pneumonia and ARDS. And because of this pollution, high PM 2.5 index or high nitrogen dioxide level, this mucosa is get damaged, and we are prone to more this pneumonia, respiratory tract infections, ARDS, and this can lead to exaggeration of asthma, COPD, bronchitis. These all like symptoms, they are caused by this high pollution level, can exaggerate, can lead into death or more complications because of this COVID-19 disease. And we all know that this pollution not only affects the lungs, it affects our cardiovascular systems also. It goes inside our lungs, and from lungs or alveoli it gets small particles. They infuse into our blood vessels also, and they can circulate in our vascular system and heart. And even it can go to lung, it can go to brain, kidney, liver. All the organs can be affected. Therefore, it's not for only the person who are affected from the respiratory disease. It can be also lethal for the patient who are suffering from the cardiovascular problem like hypertension, heart attack, angina, or CHF. These patients who are having cardiac problems or lungs problem, they are at high risk because of the COVID attack. We have seen mostly more than 95% of the patients with the COVID, they are either asymptomatic or mild symptomatic. Because of this pollution, these asymptomatic or mildly symptomatic patients can turn into severe symptomatic or very severe symptomatic, and they can land up in the ARDS or more severe problem of respiratory and cardiovascular system. Therefore, this is a lethal combination of air pollution and COVID-19 right now.
Dr. Gupta, you also reiterated that this is a deadly combination. Let's put a couple of things in perspective also, Dr. Gupta. First of all, schools are not on, right? There are no children who are going to school. There are no colleges that are up. So traffic is also not at its full capacity. And secondly, you have seen that these anti-smog guns have been deployed in the past as well. According to you, are they of any effect? And even if they are, what kind of a density of population is going to benefit from them? There are different localities in Delhi NCR which have different levels of pollution. What would be the criteria for using such guns? Is it just entirely based on an area which has the largest number of pollution levels or the largest number of people? Dr. Gupta.
Can you repeat the question?
Dr. Gupta, these anti-smog guns, how efficacious are they according to you? The anti-smog guns that are being used by the current dispensation?
They will not be more effective. Yeah, got it. They will not be effective if we don't have comprehensive measures to stop this pollution. This will be like a drop in the ocean. And I think it's like this is not a population of India, it's worldwide population, worldwide problem right now. We are fighting air pollution everywhere. Therefore, some comprehensive measures has to be taken. There should be some strict laws. There should be some reinforcement. There should be some strict order from NGT, and there should be some strict guidelines for the vehicles, for the parali, and for the construction sites, so that we can have some comprehensive from all area of like all the area from where this is generated. Basically, we have to work on each and every area of source from where we are getting this pollution, basically air pollution. So we have to like have some action points on these all sources so that we can have some solution or some relief from, and it should be permanent, right? Because otherwise we will have every year, maybe currently it is limited to 1 quarter from September, October to November, December. Maybe if it will be continued, then it will be whole year, and we have to breathe in this bad air every time. You know that because of this bad air, this COVID-19 death has been increased several times in France, Japan. There were several studies where it is found that death has been increased because of this bad air pollution only. There are few cities where this index was nitrogen oxide index was high, the death rate was maximum. Even it comprises around 76% of total COVID-19 deaths. Therefore, I think we should take some strict measures, strict reinforcement of law to stop this pollution.
Okay, Dr. Gupta, just a minute left on to our debate. What would be your advice to people who have no choice but to step out of their houses and do what they have to do in order to survive amidst these threats to their health? Dr. Gupta? So you'll have to unmute yourself. Dr. Gupta, you'll have to unmute yourself. Dr. Gupta, you're muted. You'll have to unmute yourself. Go ahead now.
We should know who is vulnerable for this pollution and COVID-19. Children less than 5 years and elderly more than 65 years of age, they are highly vulnerable. And the patients who are suffering from cardiac disease like asthma, COPD, renal disease, those who are having other comorbid conditions like diabetes, hypertension, they should refrain to go outside. If it is an emergency only, then they should go outside. And if they are going outside, they should avoid morning and evening hours where pollution level is very high. And they should avoid also strenuous or other exercises or any workload on their breathing or in respiratory system. And they should also follow all the treatment guidelines prescribed to these patients basically. Whenever they have uncontrolled diabetes, uncontrolled hypertension, uncontrolled asthma, then that can be really serious for these patients. And if they have COVID-19 disease during this...
Dr. Gupta, we have unfortunately run out of time. Dr. Gupta, we have run out of time. Unfortunately, I'd love to hear what you have to say, Rajiv.